We'll discuss about modes of spread of a malignant tumor. So modes of spread of a malignant tumor, you have two things. One is a local invasion and a distant spread. So local invasion is, say for example, you have a malignance in the stomach, the higher above it can reach the esophagus. So this is local invasion. And coming to the distant spread, this we call it as metastasis. So the distant spread of a malignant tumor is nothing but metastasis. So let's see all the possible routes wherein which a malignant tumor can spread. So the first one and the most common generally we come across is the lymphatic spread. So lymphatic spread, generally the epithelial malignancies, the so-called carcinomas, have a lymphatic spread, and they spread to the regional or the nearest lymph nodes. The best example is carcinoma of breast, which metastasizes to the axillary group of lymph nodes. The first lymph node which is involved is called a sentinel lymph node. So this is about the lymphatic spread. Next one is about hematogenous spread. So hematogenous spread generally is a feature of mesenchymal malignancies, the so-called sarcomas. These generally will be having a hematogenous spread. And again in hematogenous spread, the spread through the veins is common than the arteries, just because veins will be having a thin wall, so it is easy for the malignant cells to traverse. So this the best examples are all the sarcomas. Very rarely few carcinomas can also have hematogenous spread. The best example is renal cell carcinoma, which forms a tumor emboli which can reach even up to the heart. And apart from this, hematogenous spread is seen in sarcomas and also the few of the malignancies. Overall, the most common organ to which hematogenous metastasis happens is the lung. And the third one is within a closed cavity or the coelomic cavity, we call it as transcoelomic spread. So transcoelomic spread is the spread of the tumor happens in a closed cavity or the coelomic cavity. The best example is gastric adenocarcinoma, which can metastasize to the bilateral ovaries, which we call it as Krukenberg tumor. So here there are two unique features of Krukenberg tumor, which are always they are bilateral, and another unique and strange feature is the capsule of the ovary is always intact. And coming to the next, these are the common modes of metastasis. There are also certain less common routes of metastasis. The best example is perineurial spread. So the malignant cells spreading along the nerve sheath or the nerves, the best example of which is adenoid cystic carcinoma, which is so important, which is a malignancy of the parotid gland. And you also have pancreatic adenocarcinoma and prostatic adenocarcinoma. These will be having perineurial spread. Apart from that, another spread is called drop metastasis. Drop metastasis means a tumor which is located higher above can drop the malignant cells and cause metastatic deposits in a region lower below. The best example is a posterior fossa tumor common in childhood, the medulloblastoma, which can traverse through the CSF, and you can see tumorlets on the spinal cord. This is the best example of drop metastasis. Another very rare type of metastasis is aerogenous spread. So aerogenous spread is a malignancy wherein which the malignant cells can traverse through the airways from one lobe to the other lobe or one lung to the other lobe. This is characteristic and very common. This is very characteristic of adenocarcinoma of lung. Two unique features of this is common in young females, this is common in non-smokers. So here in which it spreads through the airway, this we call as aerogenous spread. So to summarize,